Today, we're going to share with you 7 sabotaging truths about my Ivy League education that taught me by accident. And what I'm about to share with you, I don't think a lot of doctors will have the courage to share with you. One, maybe they haven't put two and two together. They don't know what I'm about to share. Or two, they don't care and they don't really want you to know what's going on.
They're gatekeeping.
They're gatekeeping. I have spent now 20 years, 21 years in the medical industry, education included. And what I'm about to share with you, I know that you need it. I know you need to hear it because without this, you won't be able to function and thrive in life or navigate through the actual medical system. So a lot of times what we hear in day-to-day life is like, oh my gosh, I just need to go to the doctor.
Yes.
Right. And they're still, and I ask, that's a question I ask, like, for what purpose?
Well, for your well check.
For a well check. Yeah.
Make sure everything is right. Make sure if it's anything wrong, you want to catch it early.
And that has been a new theme for the past, 15 years since Obamacare has come out.
Okay.
Right. Before, when I grew up, we hardly ever go to a doctor unless something was seriously wrong.
Exactly.
So
hardly ever went. Yeah.
It kind of begs the question, like, okay, well, what is going on to generate so much illness and sickness in today's life compared to where we're growing up, where you didn't hear about all the different diseases?
That's a good way to look at it.
Yeah, and the reason why, I share this because I've had experience not only growing up, but just going through the educational system. 4 years of dental school, which is really 2 years of one the same as medical school. They go do the rotations. I do my rotations in the mouth, so I'm a lot more specialized coming out versus a lot of the doctors who have to go specialize even further. And then I think what happens is that you begin to specialize and you start to lose focus on the holistic things.
Right.
You treat the body as parts versus one.
That makes total sense. And that's why you go to the gastroenterologist, or you go to the rheumatologist, or you go to the cardiologist, right? Yep. You go to all these different doctors instead of the general med.
Yeah. And so through that experience, and then with where I kind of live on the fringe, because you're a dentist, you're just a dentist, you're not a medical doctor or a physician. Okay, cool. Valid point. But here's the cool thing about that. It's actually a good thing I'm not. It really is a good thing, because now since I sit on that perimeter, I'm not looking in, I see patients coming in, I see all the medical histories, I see the procedures, the pills, whatever they haven't done, I see the ramifications, not only in the mouth, but the mouth tells the story of the whole body. And when I see the whole body and actually what's happening, how they're not truly improving, it makes me run there and scratch my head. And that's really started back in like 2020.
That's so true. And a lot of people, a lot of diseases, you can see it starts in the mouth.
100%.
Because that's where we put a lot of the items in our mouth, right? To eat, drink, smoke for some people, right?
Yeah. So it just gives me a greater overall appreciation of how great the human body is, how the medical system is structured. And from my education point of view, I see the holes. And I'm sure the intention of the medical system is really good. But if you think about like my degree, a doctor of dental medicine, a medical doctor, the key word is medicine. And what is medicine in the Western world?
Ooh, a pill?
It's a pill. Whereas medicine, say in the Bible, the Eastern world, more natural stuff, it's food.
Right.
I think it's Hippocrates said, let food be your medicine and medicine be thy food. It's so much more powerful when you think about it. So I want to get into some of these truths that I discovered almost by accident, and they're so sabotaging if you don't think about it. And I really hope, and I know if you actually hear what I'm saying, it's going to change the way you look at things. Because really the real question is no, I just got to go to the doctor because I got something kind of wrong. Like, how do I actually find the right doctor who understands the holistic picture of the human body, and not so specific in a sense? Because once you start to realize that everything works together, then you know that you want to find that doctor who actually hears your story, understands all the principles. That way, at the end of the day, it won't cost you other aspects of your health because you're so focused on dealing with different things.
Yes, but how many doctors are like that? I'm sure there are doctors out there that exist. I'm not denying that. But how many? Because a lot of times they don't have the time to sit down with the patient. They don't care to know more about the whole entire human body because of what they've been taught, what they've learned. And it's not like they look at everything holistically. They don't. They haven't been trained that way.
You're correct. And a lot of those things you just said right there, I want to dig a little bit deeper because, that's like surface level. Let's go a little deeper. You said like a lot of doctors.
Yep.
Well, here's one thing that I discovered actually in school, and it didn't really strike me until you start hearing and see all the different things that are happening in the world as recent 5, 6, 7 years ago. And it's this, is that 50% of the doctors who graduated are in the bottom half of their class.
Wow.
Right?
It puts it in perspective when you say it like that.
They're B League. They're not professional. They're B League type of players. Like you think about the NBA, you got the top of the top. And that's like the top 0.001%. Don't quote me on that percentage versus everybody else is below them.
Mm-hmm. Even though they went through the application process to get to meet the requirements to apply and to get accepted into the school, they still go through the school and still there's going to be some that will fall behind or be in the bottom half.
Well, listen, the person who's ranked last in terms of overall GPA, when they graduate, what do you call them?
You still call them a doctor.
Call them a doctor. And so to me, the scary thing is, I know the intention is good. Hey, we got more doctors, right? Because they want to come out and actually help people. And we go to school to actually want to help people do good. But when you're actually in school, your main thing is, I got to pass this test.
Right.
No, so I can't get a D. I got to get a C. So I put myself in the position of someone who's trying to get to C, and I graduate. Woohoo! I'm the doctor. But at the end of the day, like anything else, you have a good plumber, bad plumber. You have a good auto mechanic, a bad auto mechanic. And so you have a mechanic of the body. And if you get a bad mechanic of the body, what ultimately can result? It's going to cost you, more time, more energy, your health, everything involved. Mm-hmm. Right? So then you got to start questioning, okay, well, who is this person? Who is this doctor? What's their philosophy? How do they match my values? That way, you can then begin to choose wisely who your doctor should be.
Mm-hmm. So even if your doctor is like in the bottom half, right? How do you find out if your doctor's in the bottom half? It doesn't matter, right? At this point, does it?
Well, that's where you'll never know.
You would never know.
Like you won't know where I went to school if I told you where I went to school.
Right. And nobody will know if you were in the top half or the bottom half.
They won't know. I know where I was.
Right.
And I was in the top, 10, 20%?
Yeah.
Right?
Yes.
At a top Ivy League school?
Yes.
But that's irrelevant because what I have learned outside of my medical education is actually bumped me above and beyond the people who I went to school with because now I understand that the body is all interconnected and there's different components that treat health.
Okay.
And health, that's a key word, not medicine. Health. Not healthcare, medical system. It's just health.
Okay.
Okay. That makes sense?
Yes.
That's number one. Number two is that all medications have effects.
Yes, they do.
All of them. The thing is that there's good effects and there's bad effects. Right? And so we know that we don't want any bad effects to happen. So we really do hope for the best one. And when we hope for the best one, a couple things can happen. Right? What can happen? Now, I could have all the things that we heard on the commercial just last night.
Oh my gosh.
Anxiety, depression, suicidal thoughts, weight gain,
possible
diabetes,
death,
blood sugar, possible death. Yeah.
Yes, cancer.
So I think more importantly, the question is that, okay, well, hold on here. If I take this medication, I'm hoping for the best. Do I really want to risk the outcome for that? Or actually, do I need to take for a short term? Or does it really have to take this medicine because it's really a dire straits?
Right.
And better yet, maybe that's not even a question. The question could be is there any other alternative that I can do in order to get the effects and benefits from healthcare without gambling the side effects?
Correct.
It's like Russian roulette.
Correct. That's extremely major. That's a big no-no for me. If I hear something that the side effects, well, you trade in one problem for the next, okay? If you think about it. If you hear the side effects will give you more serious problems down the road, then no, I don't want it.
Well, so here's a scary thing. It's this. I remember sitting in pharmacology class and having a little spreadsheet of all the different drugs, their purposes, or side effects, the main ones, not all of them, but the main ones. I remember raising my hand. I was like, why would I take this medicine if I know that all these bad things can happen? I was in the front row. He was over there looking at him. He looks at me almost like, why would you ask such a question that's like that? And it was like, here, I'm going to give you the answer and you better accept the answer. That was the look that I got. He says, well, you fix one thing. If something breaks, you got a pill to fix that. And that, I was like, oh, okay, as a good doctor would in school. But now that I'm out of it and I'm looking back, 10, 20 years later, and you realize that that's kind of a silly thing to believe. That you break one thing, you fix it. Man, what happens if your plumber came into your bathroom, fixes the leaky pipe, but then all of a sudden breaks your toilet? Well, I got to fix it, we'll give you another toilet.
Yeah. Oh, I'll fix that and then break something else.
Yeah.
Well, I remember few years ago, there was someone who was high ranking in the government who said that as with every medication, there's a level of toxicity in everything. He says that it's no way around it.
Yep.
Okay. So they said that that's how they have to look at it because they're trying to address the problem in front of them.
Yeah, it's 100% true. And that leads to my third point, actually, is because these medicines is built inside a system to manage disease. And disease is an unease of the body.
Right.
So I think a more important question to ask there is, okay, what's causing that unease? That way I can heal my body, which is my overall intention, without having an overall cost. Now, because in the world of the people who have the optimal health, they realize that you want to prevent it versus management or manage it.
Right. So that's where you got to live, is staying in the preventive state as much as possible. So even if someone has an issue and they go to their doctor and the doctor prescribes something, would it be better if they have no choice but to get on it temporary versus looking at it as a long-term thing?
Yeah. So the thing is, medicine has its place.
Yes.
I'm not anti-medicine by any
Correct.
means. If I had the option, here's the deal. Here's an example. There's people in the health world that believe, hey, you know what? Medicine will cure all, be all. There's other people who say, no, I'm going to do it more naturally, right? And so when you think about doing it naturally or doing more of medicine-based, well, if it naturally starts happening, well, what does that look like?
Right.
Because then I don't get the side effects. And so the question will beg itself, well, what do I want to do? I want to manage the side effects of the medicine, or do I want to have no side effects of the actual natural side of things? And that's where most of the natural people who are the most optimal health live.
Right.
Right. And I estimate about 70% of the chronic disease out there can be completely prevented naturally.
Right.
That's my estimation. Number 4 is that all the labs that come back, the numbers, they're banked on or compared for the average of America, and America is a sick nation. Right? So all the weights, all the numbers for high blood pressure, and in fact, they begin to lower all the different stats, the numbers that come back, to get you on the range that they want. And when the number goes lower, guess what happens? More medicine, more management.
Yes, and starting it earlier.
Yeah, completely. So it's not normal when it comes to labs. They are normalized. Like our kids were told that they're underweight. No, it's underweight compared to the average kid who is overweight.
Correct.
Different way of looking at it.
Correct. Because my kids fit the standard clothes within their age range. So I don't know what that meant.
They have no disease, no ADHD. They're not sick. I mean, they hardly ever get a cold. They get a cold, it goes away in a day or two versus a whole week and missing a whole month of school like a lot of kids do.
A lot of their friends do.
Yeah. So that begs the question, okay, well, yeah, all this stuff happens, and I know I can't, it's expensive to eat healthy, and I have medical insurance, and so medical insurance will actually take care of me, and that's not the point of medical insurance. Medical insurance is there to actually, if a catastrophe truly does happen, that you're taken care of like a world more acute, like you're in a car accident. That's what you want the car insurance for, them to break you. Insurance is not to keep you healthy. Insurance decides more of your treatment plan more than a doctor does.
Wow.
Think about
because
that.
they're doctors, right?
Think about that. What does it mean? If insurance behaves like insurance behaves, we all know that they deny things and they're not good. I have personal experience with it because when they start acting like insurance, they start denying the claims. They tell you what to do. You got to go through all the loopholes. They pay less. They'll deny claims. They do all this stuff. And so ultimately what you have to realize is that You need to be in control of your treatment plan with your doctor, and find them. Going back to number one, is finding a doctor who understands your holistic plan, what you ultimately want. That way, he does ask the right questions, follows the right intention, and ultimately gets you happy, healthy.
That's right. Because at the end of the day, you're in control.
Yep.
You hired these people to help you make these decisions and give you their feedback. But at the end of the day, it's your decision.
Yep. And when you talk about finding a good doctor, this is number 6, by the way. Number 6 is informed consent is so important through your doctor. And right now it's broken. So you do deserve every single risk, every benefit. So you decide, not the insurance company, the other doctors, whoever may be on the outside trying to tell you what to do. You decide, because if you get that, you will be so much more healthier than 90% of the world, because most patients, most people, most parents, they never get that fact.
No, they don't. They're told this is what it is, and this is the treatment plan that you're going to follow. No questions asked.
That's it.
And if you ask questions, then you can't come here.
Yeah, and so
because you're doubting my expertise here.
And here's a dirty secret: the medical industry is for profit.
Yeah. Okay? At the end of the day, it's a business.
Yep. Doctors are measured how well they treat stuff, and it's all based upon what the insurance will pay for. So a lot of their decision making is like, well, let's do this because insurance will cover that.
Right.
No. Here's the risk. Here are the benefits. I want you to understand what's involved here. We can do A, we can do B. If we talk about the world's optimal health, they understand the risk and the benefits. That way, when they start to realize that, hey, you know what, I'm not sure I can do this, but they can realize that they've done hard things before. Right? Maybe they had to work a little bit harder. It's not easy, but perhaps it's a better way to go, because we're talking about not managing health, but actually truly receiving optimal health.
Mm-hmm. So good.
Yeah.
So good.
Yeah. It's a really powerful way.
It is. Go back to the way we did things in terms of working with your doctor.
Your body is the most powerful vehicle on earth. If you take care of it like you were to buy a $500,000 sports car, I don't know what that feels like to drive, but I do know what it feels like is how to drive my body. And I know that when we're able to live together in a healthy form, and we negate all the big food, the big pharma, all of the propaganda they try to tell us that we have to do, even big insurance, that we get to feel and experience health, and we can drive our vehicle. And I know that if you do the same, you'll be able to drive your vehicle and just feel so good. Yeah. And you're like, wow, I can't believe I never felt so much more alive. And so ultimately, all the other 6 drives me to number 7 is this: you are your best doctor.
That's right. You know how your body feels when it's good.
Yep.
Your body is the most intelligent thing out, and it will tell you when something is off.
Yeah. Yeah. And these truths really hit me hard during 2020, 21, 22, going through my own health struggles. I understood the power behind just what I believe is the best way to go, which is more of a diet and lifestyle, and understanding that all these different components of health are all interconnected.
Yes.
The systems you have one body. The heart impacts the lungs. The lungs impact the heart. It impacts the liver, impacts the gallbladder, impacts the spleen. It impacts
everything,
the gonads,
your skin, everything, your eyesight, everything. Yeah. Yes. Take good care of your body.
Yep.
You only have it one time.
Yeah.
Take good care of it. You eat properly, get sleep, exercise.
That's it. And the thing is, you can't put it in silos. You got to work on everything all at once.
Yeah. Oh, yes.
That's the best way, and it's actually easier. So those are the 7 truths, the hard truths that have been sabotaging a lot of people. And I've discovered these really by accident, and thank goodness that I have discovered them, because not only have we lived a better life, our clients have lived a healthier and better life, and I know you can live a healthier and better life by adopting these principles.
That's right.
Yeah.
Anything else?
Nope. So with that being said, visit home, hit subscribe. You can go out to Instagram, Dr. Taj Haynes HQ, like headquarters. You can follow me there and get some more of this, a little more shorter bits and pieces of information. So yeah, that's what we do here.
Until next time, be well.
Take care.